Hello there, my name is Dorothy Pang and I am a licensed acupuncturist. And today's question is about sciatica. So, is sciatica effectively treated with acupuncture? How many sessions might that take? And what does that look like? So, sciatica is something I treat very commonly in my clinic here. Happens quite often. I think because a lot of the times for our jobs, we're sitting a lot, and sitting can aggravate or cause sciatica, especially as we get a little bit older. So, first of all, your question might be, what is sciatica even? Sciatica is a symptom, and it happens when your sciatic nerve is irritated. The sciatic nerve starts out at the low back. It flows down the low back into the glute and then down into the thigh, the knee, and then the foot. So it goes down the length of your leg starting at your lower back. It's our biggest nerve, it's really long. And symptoms can happen on the sciatic nerve, on part of it or on all of it. So typically what will happen is at the beginning, the symptoms will just be on part of the sciatic nerve, but more and more symptoms or more coverage area of symptoms can occur as the condition gets worse. So sciatica happens when the sciatic nerve is irritated. How can that happen? Well, like I was saying, that can happen really commonly if you sit a lot. And a lot of us sit for our jobs, and sitting for 40 hours a week is not the easiest thing for a sciatic nerve. Even though it sounds like that might not be a big deal, it's a lot of pressure that can build up in one area, and it can bother your sciatic nerve because of the repetition and the frequency of what's happening. So sitting is a really common way to get sciatica. Another really common cause of sciatica is bending or twisting the low back. So that can happen when you lift something. It could happen with something even as seemingly innocuous as getting out of a car. You have to twist your back a little bit to get out. But the lower back can be kind of delicate, even though we don't think of it that way. There are a lot of bones there, and they can be really easily disturbed. And when the lower back bones are out of place, they can start to jab into the sciatic nerve, and that can cause symptoms. So most commonly, we think of sciatica, I think of as pain in the low back or in the hip or the leg, but other symptoms can happen as a part of sciatica as well. So you don't have to have pain. Sometimes it's a tingling, sometimes it's a numbness, sometimes it's a weakness. And again, these symptoms can happen anywhere along the sciatic nerve route. So it could be just the low back, it could be just the hip, just the leg, just the foot, or any combination of parts. Sometimes people will feel something in both the back and the foot at the same time, and they're thinking, what the heck? Why is my back and my foot hurting? That I don't understand. But because they're both innervated by the sciatic nerve, we can have irritation in both of those areas at once, even though the connecting areas are not particularly aggravated. It just depends on which part of the sciatic nerve is being irritated. So you could have just part of the nerve irritated, the whole nerve irritated, or disconnected parts of the nerve irritated. Most commonly, again, there's pain, but tingling and numbness are also possible symptoms of the sciatic nerve irritation. How does acupuncture help with sciatica? So we know that sciatica is because the sciatic nerve is irritated. Well, acupuncture can help to relieve irritation of the nerve and to relax muscles. So often when we have a pain, our body responds by tensing up and trying to protect the body part that's in pain. So that means that we can have tight muscles in our back, in our leg, in our hip from sciatica. It could be parts of those, it could be the whole thing. Acupuncture will help to relieve tight muscles. Acupuncture also helps to relieve nerve inflammation. When a nerve is irritated, it can have those symptoms: pain, tingling, numbness, and acupuncture can calm down the nerve so that it has less of those complaint symptoms. So acupuncture can relieve pain, acupuncture can relieve numbness and tingling, and restore normal nerve function to the sciatic nerve. Most other treatments for sciatica don't get to the root of the problem. The root of the problem is that there is nerve inflammation, and your body would like to probably relieve muscle tension, typically in the back, sometimes in the hip. And that means that we want some healing to take place. Acupuncture is unique in that it can promote the body in healing itself. So when we get acupuncture, you get a dual benefit. Yes, you have less pain, less numbness and tingling, and restores nerve function, but also you get an enhanced healing response, which I don't think anything else does. You know, when you take a pill, it doesn't actually heal anything. When you do PT, we can relieve pressure, we can relieve tension, but acupuncture actually promotes blood flow to the local area so that we can speed and enhance the healing process. So yes, acupuncture can help with sciatica. It can get to the root of the problem as well as helping with treating the symptoms in the meantime. So typically when people come in for a treatment of sciatica, they usually do get relief the first time. I can't promise you'll get 100% relief. That's not typical, I will say. Sometimes it does happen, but I would say expect to have a couple treatments of acupuncture and your sciatica should be well managed. I mean, if it's a severe case, it might take more than a handful of treatments. I usually try to set the expectation that after a handful of sessions, let's say 4, the pain level is well managed. I can't say it's 0, but let's say it's 3 or less out of a 10 scale. Which most patients are pretty happy with. They're feeling much better, they're pretty functional, they can go on with their lives. And then after a 3 out of 10 is reached, it's kind of up to the patients. They can continue treatment until they get to a 0, which I always encourage, but hey, it's up to you. If you're like, I think 3 is manageable, that's okay too, and you can just test it out and see how it goes. So I hope I answered your questions about sciatica and acupuncture. And if you have any follow-up questions, feel free to comment them below and I would love to answer them. Or if you have sciatica and would like some relief, please go ahead and schedule online. The link should be below. Thank you so much. I hope to see you next time. Bye for now.